there's a lot in the pipeline, whether it's medicines or the way people bank or get educated. And we're seeing that people care about these issues, and our ability to communicate and draw people in is better than ever before. And so that's our bet, is that this next 15 years will be fundamental for the basics. Kids surviving, people having a bank account. This will be a period of incredible improvement. For a country to do well, you've got to get the nutrition of its citizens, the health of its citizens, the education level of citizens, the financial empowerment up to a certain level. And so by having these tools, some of which are vaccines, some of which are mobile phone-based delivery, then the lives they lead, the economy, really will be self-sufficient.
What specifically has changed in the 15 years since you and Melinda started the foundation to create breakthrough opportunities in the next 15 years?
Well, the childhood death is one where there had been a lot of work done before we got involved during these 15 years, and that rolled out. And so since 1990, that's been cut in half. Now we have those vaccines, some of which are just starting to get out, some of which are still in the lab, that given the full 15 years, we'll be able to get those to all of the world's children. So scientific understanding keeps advancing, understanding HIV, malaria, all these different diseases, understanding nutrition, what kind of seeds are productive, what kind of diet do you have to have, how do you teach farmers to grow more than one crop a year and use variety to maximize their output, the amount they can sell for, and what they themselves are able to eat.
What's more important, would you say? Technological innovation, awareness and support for what you're doing, or the sheer amount of money that is being invested in the kinds of programs that you support?
All of those are pretty important. It's almost like you have to multiply them together. Without the science, we couldn't make the better seeds or the vaccines or have digital money. Without the donor generosity actually getting these things out to those who need them the most, it just wouldn't happen. There's no market mechanism. The vaccines would be going to the kids who are at the least risk of getting sick, and not at all to those who have a very high risk of getting sick. But to have governments come up with that money, you need this broad awareness. You need them encouraging their governments that even though these people are far away and not often seen, and these deaths are kind of one at a time, it's not this one-day tragedy that does grab people, it's this ongoing set of diarrheal deaths or pneumonia deaths, that if you have an awareness of that and see that it can be cut, then you'll volunteer time, you might give some money, but most importantly, you'll make sure your government takes some of its resources. Even 1% would be very generous, and gets that out to poor countries.